Hi, how are you?
Good, thank you. How are you?
I'm wonderful. My name's Stephanie, and I'm a senior at MTSU, and I just want to thank you for your time today. Uh, the purpose of my interview is to become more aware with how non-traditional home dialysis programs operate. Do you mind if I video this?
Okay, sure.
This is going to take approximately 25 to 30 minutes. Please let me know if you have any questions. If I ask something that you're not comfortable with, just let me know and we'll move on to the next one.
Okay, sounds good.
Can you describe what a typical treatment day is like for a traditional dialysis patient?
Well, a traditional dialysis patient comes to a center filled with other dialysis patients. Typically, they'll spend some time finding transportation. Generally, they don't drive, and they have either some form of public transportation that takes them, or they have a family member that takes them to the clinic. And once they get to the clinic, they have to weigh themselves and go through getting their vitals checked. Typically, before this happens, they have to spend some time waiting in the lobby, in the waiting room. Even though they have appointments and a specific dialysis time, generally, just as any other healthcare provider, they typically get behind on the appointments, and so they have to spend extra time waiting.
Before their treatment?
Before their treatment, yes.
Okay.
And once they get into the treatment area, like I said, they're weighed and their vital signs are checked. They have a specific chair generally and a chair time, and depending on what type of access they have, the access is how we get the blood from their body into the dialysis machine. So there are two different types of access. There's a central venous catheter, and then there is a fistula or graft, which is a more permanent solution. And if they have that option of access, then they have two large needles that we have to insert. One is to pull the blood from them, and then the other is to return the blood.
And these needles are about the same size as what you would get like a blood draw with?
No, they're much larger than that.
What would you compare it to?
I would say probably a little bit smaller than like the straws that you use to stir your coffee with.
Oh, goodness.
Yeah, they're rather large. So that's not a comfortable thing to have.
I imagine not.
In your arm or your leg. Generally, it's in your arm. The other type of access goes straight into near their heart and is very prone to infections. So we generally try to steer clear of those types of access, but they are an easier and quicker way of accessing the blood, and are less permanent. After we have accessed the patient and we hook them up to the machine, we're pulling blood into the machine, and at the same time it's pulling fluid off of them. This can be hard on a patient's heart if they have heart problems.
Mm-hmm.
And most patients tolerate it well, but some patients may not.
What do you mean by may not?
Well, there's a potential for their blood pressure to drop because we're pulling fluid from them so quickly, maybe quicker than they're able to tolerate. And so if their blood pressure drops, then we have to give them saline and treat them for that. they may get sick, they may not feel well. It just depends on the patient and the day and how stable they are.
Now, is this something that goes away as soon as the treatment is over?
No, I mean, it can go away as soon as the treatment is over. It can go away once we administer some saline and get them a little more hydrated. But some patients still feel the effects of the dialysis after the treatment. Like for the rest of the day, they may not feel like up to doing their normal daily activities that they would generally do. So it just depends on the patient and the treatment for that day. And then after the treatment's over, again, they either have to wait in the lobby for their transportation or wait for their family member to come and take them. And so it takes up a good portion of their day.
And how long is the dialysis treatment?
Generally, the dialysis treatments are between 3 to 4 hours. 4 is generally more common in the in-center. But there are patients that do have to run up to 5 hours.
Wow, so to combine that with the time spent with transportation, waiting in the lobby, then to add the treatment on top of it, then some more waiting and more transportation, they spend a good portion of their day there.
Yeah, and their treatments, generally they run three days a week. Some patients may need to run 4 days a week if they put on a lot of fluid between treatments. But yeah, 3 days a week, pretty much their entire day is filled with.
So this is like a job for some of these folks.
Yeah, it would be considered a part-time job, but they're
So
not getting paid.
Are these patients able to work regular jobs? I mean, you said that they are there for a good portion of the day. They might not feel well afterward. They're here 3 times a week. Do a lot of them work? Are they able to work?
I wouldn't say a lot of them work. There are some patients that are able to work, but the majority of patients, that's pretty much what their life consists of, is dialysis. And then a lot of times on the days that they don't have dialysis, they may not, again, still be feeling quite well. And so a lot of them, it's not really an option to be able to work in addition to that.
So if that's a typical dialysis patient, tell me what other treatment options dialysis patients have other than what is routine in center.
Well, there's also home hemodialysis, where the patient can do a similar treatment to what is done in center, but they can do it in their home. And this requires either a family member or a caregiver to assist them with the treatment.
Okay.
Because it's not really safe to be doing it on your own, due to
so they have the same potential for complications that they would have in an outpatient facility?
Correct.
Okay.
Another treatment option is peritoneal dialysis, and that requires a catheter be put in the abdomen, and they fill it with fluid and then drain the fluid. They can either do it at night or they can do a few exchanges throughout the day. That generally is a better option for patients that want to be more active and have more freedom with their dialysis.
And is this something that anybody can do?
No, the peritoneal dialysis, there are certain requirements that are involved with that, so that because there's a higher risk for infection of their catheter, they have to have a very clean environment. They have to be able to, store the supplies. It requires a large amount of supplies, so they need to be able to store those at their home. And Generally, it requires a caregiver or a family member to assist with that. So it just depends on the patient, but not everyone is a good candidate for the peritoneal dialysis.
And what are your thoughts on the home therapy, different options for home therapy dialysis treatments?
Well, I get, in my opinion, it just depends on the patient and their particular situation, whether they're working, their age, what kind of support they have at home, if they have any other health complications, which generally most of them do, but it depends on which ones they are. Because like I said, the hemodialysis is harder on the heart.
Right.
So if the patient is having, has problems with their heart, then, maybe peritoneal dialysis would be a better option for them.
Right. So recently, the Centers for Medicaid and Medicare and the government, there's been a big drive to get more dialysis patients at home. And as a result of that, we're seeing lots of these smaller companies like your company pop up that are now offering an alternative form of home dialysis therapies. Can you tell me a little bit about that?
Yes, what we offer is a staff-assisted home hemodialysis program. So the patient can have the same benefits as the treatment in center, but at home, and it doesn't require the help of a caregiver or a family member. A staff member that is certified in hemodialysis is sent out to the patient's home, and the patient is treated at the home with a trained technician. That way it alleviates, some of the pressure off of the family, and it allows the patient the freedom to not have their whole entire day tied up with a dialysis treatment 3 times a week. We come out to the home, we have all the supplies and the equipment there, and their 3-hour treatment just takes the 3 hours. They don't have to wait for transportation. They don't have to wait for a chair time. It gives them more flexibility. Like, if they were working, then generally we try to work around their schedule so that it's more convenient for them. And I think that this also helps with the compliance of treatment, because they don't have to go through the hassle that is trying to find transportation and waiting and taking up their whole day. It's more likely that they will actually go through with the treatment, because there is a number of patients that don't come to their treatments regularly because of the inconvenience. And
it almost seems like this would now allow them to plan dialysis around their life rather than plan their life around dialysis.
Exactly.
So do you feel that this new alternative way of performing dialysis and giving these options for staff assisted is going to improve the quality of life for existing patients that are out there?
I believe it would. We have a number of patients that just aren't physically able to get to a dialysis clinic. We have some that are bedbound or have, a trach, and so this allows for them to get the treatment that they might not otherwise be able to get.
Now, are you saying that if they're bedbound or they have a trach, they would not be candidates for the traditional model of dialysis?
Generally, when centers are looking at candidates for dialysis to be accepted into their center, they look at those kind of other complications, I guess you would say, and oftentimes they are a bit hesitant to accept those types of patients into the facility because they require extra care from the staff, and sometimes the staff isn't able to provide that extra care. So like a patient with a trach, you know, if they're at home with their spouse or whoever that takes care of their trach, that's one less worry that the staff in the center has to worry about.
Right.
So we take a number of patients that other traditional in-center
programs typically wouldn't
accept, right? And so that in itself, to me, would provide a better quality of life for the patients. And like I said, we try to work around their schedule, and you know, they're able to have more activities and have like a more structured day, knowing, you know, that they don't have to sit and wait in transportation or things like that.
Right, yeah. So, of the different modalities, we've talked about staff-assisted therapies, we've talked about hemodialysis, in-center hemodialysis, peritoneal dialysis. Which would you consider the modality of choice, and why?
Well, I think that the newer form of staff-assisted home hemodialysis, in my opinion, would be a better choice in most cases, just because, like I said, it's a trained technician doing the treatment, and in addition to having the like extra time and everything at the center, there's also a lot of different personalities in the clinic, and some patients don't really like that, so they prefer to be at home, you know, and they don't have to deal with all of that kind of stuff. So
would you say that there are any cons to the staff-assisted therapies?
I guess probably the biggest one would be just the inconvenience of having the equipment and the supplies at your house. You need to have like a certain amount of, you know, space for storage and that type of thing. And just having the equipment, I mean, you can't really like put it away. It's just like, you know.
So you're kind of turning your house into a small clinic? Or
yeah,
doesn't take up that much space?
Well, it doesn't really, well, it doesn't really take up that much space, but it is, you know, like not something that you can just like put away, or, you know, it would be kind of like become a new piece of furniture just sitting there. So
is there any other information you'd like to share with me about the new staff-assisted alternative programs that dialysis patients are now being offered?
I just really think that CMS could take another look at the validity of the program and what we're trying to do. There are certain regulations that are in place that differentiate between a caregiver and an actual technician, and an actual technician, of course, comes with a lot more rules and regulations.
Right.
But to me, it just makes more sense that you would rather have a trained technician that is actually certified in hemodialysis do the treatment rather than your brother-in-law that was just trained to do it and isn't,
6 weeks ago.
Yeah, 6 weeks ago, 6-week training, and they're able to do the treatment just, fine under the regulations. But there have been some issues with having an actual trained technician do the treatments, which I think is absurd, but that's just my opinion.
Well, I just want to thank you again so much for your time today.
Thank you for yours.
If you have anything, do you have anything that you'd like to ask me?
I don't think that I do. I think we've covered everything.
All right, well, thanks again, and I hope you have a great night.
Okay, you too.